Welcome to Time Warner Cable's local edition. I'm Brad Pomerance. Our guest is Dr. Lakshmi Tegulapalle. She is a radiologist at the Huntington Breast Center. And I'm so glad you're here. We all are concerned about breast health. You know, our mothers, our daughters, our wives, our aunts, our grandparents. What can you tell us about breast health most generally?
Fortunately, breast cancer, when it's diagnosed early, is much more treatable than when it's diagnosed later. So the advantage of having early screening for breast cancer is very good.
And let's talk about that, because I know there's a bit of controversy about when women should start getting mammograms. Absolutely. Should it be at the age of 40 or should it be at the age of 50?
So
and of course, risk factor is separate, but if there are no risk factors.
If there's no elevated risk factors, then we follow the American Cancer Society guidelines, which are very clear and have not changed in recent times. So we recommend that women have their first or their baseline mammogram at the age of 40 and annually. So every year from 40 onwards.
And so if you have that every year and something comes up and it somehow develops within that year, the sense is it's early enough to combat and treat.
Correct. So not only is it that the mortality drops over the course of time with women, populations where screening is very robust, but also that when cancers are diagnosed, the treatments tend to not have to be as aggressive.
I see.
So our hope is not only, of course, to decrease mortality, but also that women, when they're diagnosed, that their treatments are more tolerable.
What are the risk factors that would indicate you should have mammograms maybe starting at 35 or every 6 months?
Or younger. So family history is a big risk factor. So women who have a first-degree relative who have a diagnosis of breast cancer, they may need to start screening earlier than the age of 40.
What if that breast cancer diagnosis was from a grandparent who got it when she was 78?
Then the likelihood of that increasing the woman's risk is less.
I see.
Fortunately. So it's really those women whose mothers or sisters were diagnosed at younger ages, premenopausal women who are diagnosed, that we need to be a little bit more concerned. So those women are strongly encouraged to talk to their physicians and consider having screening mammography earlier.
What about postmenopausal hormone therapies? That is also a source of confusion.
Correct. So we like to encourage women to have a good dialogue with their primary physicians. So there are many advantages to postmenopausal hormonal therapy. And for those women where the advantages outweigh any risk or concern with regards to breast cancer, then we encourage them to continue to speak to their physicians. But be proactive. Understand what your risks are and what benefits you're getting from hormone replacement therapy.
Are the risks an increased propensity towards breast cancer?
There's not a real strong link between increasing the risk of developing breast cancer. We just don't know if there maybe is a risk of having feeding the cancer a little bit with those hormone replacements.
I understand.
Some breast cancers are stimulated by or grow with certain hormones, and so then we have to be concerned. But overall, it's like most things in life and in medicine, you have to weigh the risks and benefits.
Of course. Should someone receive a diagnosis, what's the next step?
First and foremost, you want to have a good conversation with your primary physician about the diagnosis and about the next steps, which often include having another test. Sometimes we recommend having a breast MRI, which helps us determine how much tissue is involved.
I see.
But also to have a consultation with a breast surgeon.
Of course.
Someone who is able to guide you through the treatment options.
Doctor, thanks for joining us. We appreciate it. My name is Brad Pomerance. This is Time Warner Cable's local edition.